I would like to thank you all for being here. We have great panelists on board. We can start first by asking this question. What is your story with WBE? When did you getting involved with wastewater-based epidemiology? Some of the projects you've been working on, applications. Professor Jason, you can walk us through.
Thank you very much. And thank you for the opportunity to speak with the panel today. It's a great honor. We began our wastewater-based epidemiology work in the summer of 2020. Prior to that, I'd been doing a lot of work with wastewater and other types of water sampling for pathogens and other water quality-based contaminants. But in the summer of 2020, we pivoted and organically formed a grassroots team that included myself as an engineer and the water collection guy, along with microbiologists and epidemiologists and public health professors, all at the University of Oklahoma and the University of Oklahoma Health Science Center. And we began by monitoring on our campus at the University of Oklahoma in the dormitories. So we were monitoring where the students were living. Oklahoma is a relatively conservative state, relatively low resource probably compared to some other states. And there was not really great case numbers. And so we were able to utilize the wastewater to get an idea of trends and potential outbreaks at the University of Oklahoma. From there, we moved on to several wastewater municipalities, sampling their wastewater treatment plants. And then we also monitored from manholes with auto samplers that were provided by one of our other speakers, Kaushal Trivedi. We were able to do that and monitor a little bit more granular within Oklahoma City, which is a community of about 500,000 people. And so from there, we connected those concentrations in Oklahoma City with case numbers, and were able to develop models that included demographic information. And so we were seeing different lead times for predicting cases depending on the demographics within the community. From there, we moved to Tulsa, Oklahoma, and worked with the Rockefeller Foundation and the Pandemic Prevention Institute, also looking both at the community level and what we call dynamic sites. And so our dynamic sites were looking at areas or specific issues that the city of Tulsa had so that we could explore things a little bit more on the fly when things were of interest. And now we're moving out to a statewide network of 30 communities within the state so that we can get a better handle from a broader sense, and also using passive sampling to look at a broad range of pathogens, not just SARS-CoV-2, at facilities. And so we're able to utilize these cotton bud tampon-based samplers to confirm outbreaks at assisted living centers, because a lot of times they'll come in really quickly. They don't necessarily get tested. They'll have an idea based upon the symptoms, but they aren't able to confirm that. And so with this, we're able to confirm it within a day or two and help them to know, yes, this is what it is. And so they know how to treat it.
Wow, so these are real examples of how wastewater-based epidemiology have helped in terms of mitigating the challenges of the pandemic. We'll get back more in detail about the topic. Before we move on, Kaushal, can you share also your expertise and your experiences with WBE?
Yeah, sure. So WBE term got popular with this COVID-19 outbreak. However, WBE tool was used in the past, and we are in sampler business since 1970, and we were not aware, honestly, that our sampler were used in past for the WBE. But we found out when this topic became very popular, we found out that some of the university and one of the local university, they have used our sampler for WBE in past. But let me put the timing in context of COVID-19. A couple of years before COVID-19 outbreak hit in 2020, there were some labs as well as entity. They have used our sampler for opioid outbreak by doing the wastewater analysis in the neighborhood area. And 1819, our sampler were used for that. And as in the United States, opioid overdose is a public health concern. So that's why I'm putting in a context of WBE there too. And the same entity, they were doing the opioid and outbreak analysis In 2020, when the COVID hit, they used the same sampler they purchased for that. They started using it for COVID analysis. So we are in this WBE for the COVID at the beginning of 2020. Our samplers are used in that. So that's our journey, and we are continuing with that journey, and our samplers are getting used more and more. Now CDC has just provided a grant for sampling the small community. That's 225 small communities will be surveyed. Glad to be a primary supplier of the sampler. Plus we have users like Dr. Vogel. We learn a lot from him. I visited him for understanding how they are using the sampler. So that's our journey. But across United States as well as globally, even in Singapore, our samplers are used for WBE.
Thank you, Kaushal. You brought a good point, like working hand in hand with researchers, professors. And when we selected this panel, we made sure that we have a mix of private and government sectors, but at the same time also research, R&D, education, supplier, technology, and integrators. And I think that's what brings a depth to the discussion. I like the fact that you went back also before the COVID pandemic, and I think the COVID gave a new dimension to the WE, because I remember Professor Savic, we had a video call, I think back in August 2020, this was just when the pandemic started. And you told me back then that it has always been used in the Netherlands to monitor drugs, to monitor several things. Do you think we've shifted quickly in terms of applying to the COVID-19? And also, have we been able to predict new outbreaks? And did we issue early warnings? Because there are a lot of hype about it, but has it been really effective in helping mitigate?
The direct answer, yes and no. There were some indications that we can do that, like early warning, 3 to 7 days, depending on the local situation. Also, on a much smaller scale, there were some applications within university campuses where anything that was found in terms of SARS-CoV particles in the sewers were alerting people to start testing, in that case, students or employees. But on a large scale, no. Much more kind of important link is to the health and the limited testing among the population in the medical centers, because with sewers, there is no choice. Everything ends up in the sewer in the city, and you have an overview of what is happening with the entire population. Whereas with sampling that we actually do by people either voluntarily go or they're asked to go and be tested, you have a biased sample. So to get unbiased sample of the population, link it to the health of the population, you can do that only through wastewater-based epidemiology. And as you said, we've been doing that for over 10 years in Europe, but looking for different metabolites, looking at illicit drugs as one of the methamphetamines, amphetamines, crack cocaine, but also looking at all the metabolites that are product of our environment and our lifestyle in terms of the use of alcohol, nicotine, or use of medication. So there is a long history of WBE, but with a particular application and the push, if you want, to use it much wider. So we now have in the UK and in the Netherlands and many other countries a nationwide program of testing sewers for particles. So I can see easily that we're moving into using it for various other purposes.
Speaking of other purposes, Windi, you invested a lot on drug resistance. And can you tell us more?
Yes, thank you. First of all, thank you for the opportunity to be part on this panel discussion. And yeah, in our case, we are a system of laboratory service based in Helsinki, in Finland. We focus on the antibiotic resistance and of course in the genetic material, because we collect all the DNA samples from the wastewater, and then we try to detect and quantify the presence of these resistant genes. It is slightly different on how the analysis is done for the bacterial genetics compared to the SARS-CoV-2, because one is viral and one is bacterial. And we focus mostly on antibiotic resistance. And as you may know also that antibiotic resistance, it is also the global pandemic. It's just silence compared to COVID-19. And we are trying now to optimize, and indeed the current situation is like trying to add value on this wastewater monitoring. And we cannot just get any result from only wastewater monitoring. We need to combine, right, this information with the public health and what is the meaning of this data for the public health. Let's say we found this level resistance is really high. So what is the value for the public health on knowing the information that we provide? In this case, we focus on the antibiotic resistance and pathogens actually, because before there's a discussion that you're also monitoring pathogens, but in the molecular method, we use the culture independent method. So hopefully that we can detect more sensitive in this case.
Thank you, Dr. Windi. And if I go back on the COVID tracking, so we've seen some limitations. There were some talks about the Omicrons not being well detected and so on. Are there any limitations for the WBE in tracking COVID-19? Anybody wants to answer?
There are limitations all along the chain. One obviously is a resource limitation. Who's going to pay for it is a really big question. And it is more cost efficient than doing all individual clinical testing, but it still does have a significant cost. From there, collecting the samples and collecting them in a way that's representative of the population can be a limitation, depending on where you're at and what scale you are at. If you're trying to collect from a manhole, there may be times where there's vandalism or other things going on, and it's harder. There's weather issues in cold weather climates. Those samples can freeze. From an analytical standpoint, there's not necessarily one standard way to analyze for SARS-CoV-2 across the world, and comparing data from one place to another may be a little bit of a challenge if they're using different type of techniques. And then the final one is just the communication and getting the data actionable in amount of time that it's useful. So that's where your partnerships with the public health community are so important, because we can get the data, but if it's not put into action and utilized in time for it to have a public health impact, then all we just have a bunch of data. So all of those things are limitations, but I think things that people are working on around the world and are things that can be overcome eventually.
I will in full agreement with Dr. Vogel here. I will also say that there are some improvement in a collection system is also required, especially in the remote, like neighborhood treatment plants. You have your access to the sample is very easy, but remotely it is challenging. And we have seen that the awareness is not there. So when the initial stage of COVID-19, people realized the importance of WBE, and they started collecting the samples, and they collected a grab sample, manual grab sampling. And there were a lot of error, because that's a human error where you are collecting the sample on the top of the channel or the bottom of the channel. So it is over a period, it is established that composite sampling is a much better method for these neighborhood areas and or building areas kind of thing. But it's still that awareness is not there. And as Dr. Vogel mentioned that, yeah, it is a funding limitation is also there. So there are two, major issues, I think, in techniques. There are a lot of advancement has taken place in last 2 years for data analytics and predictive analysis and early warnings and kind of a stuff. But still, it is the frequency of sample collection is it's all depend on frequency of sample collection. Because of the resource constraint in the neighborhood area, people are collecting twice a week, the fastest way. Otherwise, it becomes very expensive. So they miss the day in between. And if something happens during that, the day get missed, that will not be counted. So those are the kind of still limitations of WBE.
Thank you, Kaushal. Now that the pandemic is moving on, and even though we're seeing in the UK and Netherlands, numbers are going up again. So what do you think will happen? Is WBE will go back into the, like lower priorities? We'll continue seeing investments in WBE. What do you think will be the directions in terms of investments?
I will start here. So I will say here that WBE is going to continue, and all the benchmark we are seeing that it's going to continue. It is not just because of it's a cost-effective tool. It is a tool that provides an early warning and which is required for the public health crisis. That's what it is required. So it is going to continue. And I was reading Dr. Vogel's some of the research, and he also mentioned that he has expanded his research, not just limited to COVID, but other pathogens. One of the paper, he mentioned about the detection of the common flu. It can be detected through wastewater analysis. So I think it's going to expand beyond COVID, and it's going to go to pathogens. And she also mentioned about antibiotics. That's also, it's a new field. People are, and because of, I know that antibiotics is very difficult, pH, conductivity, everything you can analyze very easily, but a microbial compound, it's very difficult to find. What I also think that there is a limitation of the days frequency. I think there should be in future, there should be an innovation should take place, and Mr. Savic will agree with me that remote communications need required from the field, that something happened, it should be immediate alert should be created so that we don't miss the time in between, either days or hours, we don't miss. So there should that kind of a technology available. So for the funding, answer your question on the funding, I think it's going to be funding from both private and public. As I mentioned, CDC has a grant, and a lot of people are funding from the public sector. We're going to see those kind of funding, but at the same time, I also see the funding from the private in innovating new technology. Like company like us, we might look into finding how we can create an alert faster than others. So I think funding is going to take place from both public and private.
I can add to this, because this is getting the genie out of the lamp. You can never stop that anymore, because people have realized what the value of wastewater-based epidemiology is. And the innovation is not going to stop. I think we just heard about composite sample, like 24-hour sample. Because of the variability in the wastewater flow, you cannot just rely on a grab sample and once a day or once a week in certain areas. So it has to be continuous to give you an overall picture of what's happening. But also now we have a situation, you have to sample, you have to go there, take it to the laboratory, do whatever is in the laboratory. And there is quite a lot of innovation in on-the-chip analytics, and that's the future. Okay, it's not behind the corner, it's not this year or next year, but over the 10 years, I would confidently predict that we should be there. So you don't have to take everything to the lab. You don't have to employ so many people, although then we will have to employ the people to develop these algorithms and everything to do on the chip analysis.
The other thing that I would add to that is I think the global public health community is really seeing the benefit of wastewater-based epidemiology as part of a tool in your toolbox for looking for the next pandemic and for doing global health surveillance, because you have clinical sampling and you can have environmental sampling, you're monitoring in animals and in wildlife, and wastewater can definitely be part of that bigger picture. And that's going to have to come from a combination of public and private funds to get a global picture and to make that come to fruition.
Yeah, Windi, you want to say something?
Yes, and I'm myself coming from the private sector, and we are indeed developing that innovation now, for example, beyond COVID. And as I mentioned, we focus also for pathogens, even though we focus only on the bacterial pathogens and antibiotic resistant genes. But indeed, like we try to optimize, I agree also with the composite sampling, because it is important to understand the whole wastewater, and even like in the location on the site of wastewater where the samples should be monitored, whether it's like covering. Our innovation now focusing on the hospital, where's wastewater in the hospital, and it's very important that whether the sewage is coming from the infectious disease control unit or from the whole total hospital, because we learned that if it's coming from the whole hospital, we rarely can detect the pathogens. But then if we sewer system directly from the infectious disease unit ward, then we really can detect the pathogen. So it is now we learned that there's an important, even where the location, where the wastewater should be collected. And now we are still in the stage of developing the technology to be more like efficient and cost effective. I believe right in the future, it's still a challenge. And Professor Dragan mentioned that it's important also to reduce the need on the test to sending the samples to laboratory, it will be nice to have this on-site monitoring, but even though for that may be a bit hard to do in the molecular work, so the sample needs to be sent to the laboratory, but maybe there is the network collaboration laboratory, satellite laboratory around the globe to be partnering, and then contribute the data into same database. Like in our case also, like we developed the database, global database, to combine all this wastewater monitoring into one system. The difference now from bacterial genetics to the SARS-CoV-2 monitoring, at least the standardization of the methodology a bit easier to standardize, because bacterial genetic analysis is much more, let's say, simpler and established for the qPCR. And I believe everyone knows here that qPCR is much easier to standardize for the bacterial genetics. But yeah, for sure, in terms of the funding also will be coming both from the public and also from the private sector, because we also get a lot of funding from private sector on developing this wastewater monitoring. However, as I mentioned, for the base epidemiology, it requires more connection, how this will be used, connecting to other data. So that's, I still feel that it's a bit more challenging for the public health on how to use the data from wastewater monitoring.
Windi brought a very good point about sampling based on location. It is different whether you do it in a treatment plant versus neighborhood versus a building outlet. So Teled and ISCO understand one having the major player in the market, it's a one thing, but we also have some responsibility in educating the user that what kind of sampler to be used. So last 1.5 years, we had joined hand with a lot of companies and doing a joint presentation just to educate. Our role is to educate the user how to collect the sample depending on the location. If you are doing in a sewer area where the flow is changing during daytime, you should do the flow-based sampling, flow-based composite. I'm not saying sequential, flow-based composite you should do. So different way, even in the next week, we have a public health conference arranged by WEF and CDC. That's what our role is going to be, educate the user that what sampler and how to sample based on location. But I agree with Windi.
I think it's a great point you are bringing both. And Kaushal, if I recall, you guys have a large project in Abu Dhabi, for example, where we're sampling most of the city in terms of neighborhoods. And it's important to see where is the sample point located to be able to isolate and also try to understand the relationship. There's a question that came from Antoine Walter. Do you have a rationale why WBE seemed to be rediscovered by major media every second week for the past 2 years? They rediscover it every time and they talk about it as it's something new. Does mainstream exposure change something in your daily work?
It is interesting that he mentions media, and media work, we can see that today really well in the crisis situation. And that's why I think the exposure is such that they are coming back to something that people have developed a long time ago and used it for various purposes. But to be fair to them, this link to the public health hasn't been clearly defined, at least in the media, and it's becoming more and more prominent. So, for example, we work with the health organizations, for example, to link the two sets of data, and not just that, but to discover all these new variants. So sometimes we discover new variants first in the sewer before it's discovered through the testing of the population. So it's not just early warning system, it's understanding of the prevalence of particular strand or particular variant that is important. And then if you expand that into various health issues, how, for example, various lifestyle choices affect the health of the population. I think 10, 15 years ago, I read that the most often and highest concentration of illegal medication drugs in wastewater was diclofenac, which is genetic medication for back pain, for pain in general, pain management. You know how that information could be very useful for health authorities. Windi is looking in microbe resistance. But what do we do with the areas that the resistance is high? What do we do to an area where maybe GPs, general practitioners, are prescribing too many antibiotics or too many of these, there could be much more intelligence that could be gained by linking what is discovered in our wastewater to the public health data in our health systems.
I would say from the media standpoint, in our aspect, we've seen a real evolution of how the media treats our data. And it started off where we would put out news releases when there was something significant. And right at the beginning, there was the ick factor and the weird science factor, and they wanted to come out and watch us collect the samples from the field. And then from there, they started to really recognize from outlets all over the region that this could be useful. And because we're in the middle of the US, a lot of times the outbreaks would start on the coast and move into the middle of the US. So they figured something was coming, and they started to reach out to us as wastewater-based epidemiologists to see if it's starting to show up in Oklahoma. And even during when Omicron was coming in, we were able to use specific primers to look at the specific variants and look at proportions in the wastewater. And at that time, the clinical data, there was an issue of getting the clinical data out. So we were the only game in town of looking at when Omicron was moving into Oklahoma. And we actually had hospitals reaching out to us because there were specific antibody treatments that were only useful for Omicron or for Delta, and they wanted to see where things were at in our major communities. And so the media has been a great partner, and it started out with this, wow, this is really weird, to something like, wow, this might be the best source of good data we have at certain times.
I would like to add regarding this media, I think media also is a good platform to educate the community the importance of this new technology, for example, and of course reach the policymakers that is the importance of this wastewater-based monitoring or epidemiology, especially when we add the data together. So I think it's very important indeed to have this media, what's called like covering what we are doing now in this case. And I was thinking that maybe it's important also from us, like who are doing the work, to reach also the media, not only wait until the media came to us, but try to reach them. At least in my case, since we are coming from the private sector, we need to do of course, inform the media that this is going on, that we need. And then media, I believe that is the best platform, not only to educate the community, but also to reach the policymakers and the authority, especially regarding the funding, right? Like we were discussing who should pay this. And I understood that after meeting with several authorities that they say it's supposed to be the one who used the data should pay, and which is mean that this is the public health, but then the public health are willing to pay until they know what the data can be used. So we need to wait. And I believe that media will help us on trying to communicate this in the wider community.
Correct. And Kaushal, maybe you can help me on this one. So today, what we do, we basically take a sample, correct? So for example, your samplers can grab a sample every hour, every half an hour. We can fix the time. What is it going to take to get to an innovation level where we can do online testing? And so how far away do you think it is? And maybe on the R&D side, the others can also comment.
Yeah, one of the idea that Mr. Savic mentioned about a chip having, while you sense it through a chip, and while taking the sample, or take a sample when you get a signal. So that kind of innovation, we don't wait. Yes, we do verify by collecting the sample. It's a different story to find out more, but the chip will tell us right away that something has happened. Very recently, there are a lot of toxicity analysis are done, wherein that the sensors will give the alert, and it also trigger the sample to take a sample so they can do what kind of toxicity in the wastewater is there. So that is the kind of innovations I'm seeing that will be used along with the sampling. It can be part of sampler, or it can be an external device connected to sampler.
So basically, we're talking about indirect measurement, like where we get a trigger for us to collect the sample and go and measure whatever we want to measure inside, correct?
Yeah. So sample is collected in a real time when it gets triggered. Analysis will be done in a field for which kind of pathogen, for an example, or which substance or microbial resistance kind of stuff. Yeah.
Yeah, correct.
I would add, this is not directly my area of research, but I've had conversations with people where they're looking real time for emerging contaminants and other types of things. And specifically with the viruses, I have had discussions about them being able to attach biomarkers to the virus. Perhaps like if you're looking at neighborhoods and you would put it in one manhole and then analyze it in the next manhole. So you're looking at these biomarkers that very specifically attach to a specific virus. It's not something that we've applied, but I think it's a potential to get even more real-time analysis from the field. The other thing that you can do is that if at specific locations, there may be some other types of analyses that are more easily done that could correlate, and it could give you, at least from a planning purpose, and maybe it gives you a time where you need to go out there and collect the actual sample. You could use some correlations to other types of, whether it be chemical or microbial or other types of indicators, to give you an idea when you might need to go out and collect a sample.
Thank you, Professor Jason. So one question comes from Ghana, and this is from Theophilus. He's saying that most African countries have not yet closed the loop when it comes to wastewater reuse and recycling. And his question is, what could be some of the risk factors we face with regard to WBE? And what would you say should be the roadmap for WBE management if you're starting from scratch, let's say like in Africa?
That's a very loaded question. Lots of questions in one question, I would say. First of all, absolutely, quite a lot of developing countries or low to medium income countries, they don't have centralized sewer systems. But even for those, there is a WBE link, because either they use open channels, which could be used then for sampling, or they're using latrines and pits, and that is collected from time to time and put into a central place and then either treated or left at a waste disposal. But then the samples could be taken there at the place where it's concentrated. So it's not impossible to do some kind of wastewater-based epidemiology of that kind. The other part of the question is, should low and medium income countries go for centralized or decentralized or hybrid wastewater management systems? And even the West is now moving in the direction of wastewater treatment on a local level. And yes, but also I would mention that we need to look into kind of historical ways of countries or areas in the world when they're dealing with the waste management and wastewater management, so that we can learn from those historical practices and apply a localized method rather than copying something that was happening in the industrialized England in the end of 18th and the beginning of the 19th century. So that's my view of the issue.
I would like to add, I myself from Indonesia, and we do now try to test piloting our wastewater monitoring in Indonesia, Thailand, and Nepal. So we do learn that indeed there is no decentralized wastewater treatment, and it's so hard to. And then many of the treatment also still releasing directly to the river. So river actually may be as a marker in this case, or otherwise that we can collect that septic tank, which is, there is a company usually where collecting the septic tank from the community, and so we can collaborate with this kind of waste management. However, since there is a limit of resources, I believe that is the most important is starting with the sources. For example, like hospitals, animal farms, a slaughterhouse, and like the potential of any pollution, let's say, that I'm seeing myself in the point of view of antibiotic resistance, sorry about this, but let's say in any type of pathogens, but that we can start from the point sources, and then we can continue to see the community. And so far, we work in hospital, and because each hospital usually have their own wastewater treatment plant, so then we can test it already, how it works. And hopefully when they know the benefit of this wastewater monitoring, and they know, like we agree that the cost is much cheaper compared to we monitor individual person, so that hopefully that it can help the public health in the country as an early warning system, then have a better intervention.
Yeah, currently, so infrastructure as well as funding, there are two major issues for the developing country. I talked to some people in country. that why this is the WBE sampling is not so popular in your country. And I was told that first is lack of sewer network, or wherever there is a sewer network, there is a lack of connections. So many times that the residence is not connected to the sewer. So if you try to do it at a wastewater treatment plant, you don't get the real good spectrum of that. So there are the two major things. Having said that, everybody is realizing, including developing countries, the importance of that, because this is the very cost-effective tool. And if it is not implemented, there is a major economic impact will be there because it's a public health. So I am seeing a lot of awareness is coming up and a lot of activities also started taking place. And actually, I will say that I had an opportunity to read again Dr. Vogel's some research in his this statewide plan that he is also doing. Some of the sites are septic tanks. Correct me if I'm wrong, Dr. Vogel.
Not as part of the statewide plan, but as part of some other proposals, you bet. There's a ton of great points here. And I think how we treat the data from something that's like a pit latrine or a septic tank is so important too, because in a flowing sewer network, that's one point of time and representative of the people that were going to bathroom at that time. Whereas a septic tank is representative of everything that's happened since the last time that tank was cleaned. But you also have the really unique dynamics of what's happening to each of the different pathogens we're looking for within that network. It's probably anaerobic, and what's the survival, not of the infectivity of the pathogen, but the survival of the genomic material, because we can look for things that aren't necessarily infective. And that's a whole new realm of research. It's a different type of application than a lot of our recreational pathogen research and things like that are. So it changes how we're looking for these things, but then how do we connect something that's one point in time with something that's a time-based composite over many months or years are both interesting questions to me, because there's so many more people in the world that are not connected with flowing sewage systems that we don't want to leave everybody out that's not connected. And to get the true picture, we need to be able to look at all of that.
Obviously, when you start collecting all these samples, you get more data, and you get them from neighborhoods, from hospitals, from schools, as you mentioned, all the examples. So what are the ethical considerations that we should be taking regarding the protection of individuals and communities? What do we need to consider, and how do we address them in terms of WBE?
Can I start? I'm so excited about this data. It's because we are trying now to get this and working on this. And to our knowledge, at least in wastewater, we cannot really can see any individual data because it's like mix of everyone. However, we work still on the GDPR, working on, even though from the wastewater sample, because there, to our knowledge, at least in EU, there is no such yet regulated from this microbial data of individual, because microbial data cannot really explain individual. It's not the same when you have the genetic material of the person. Still, it's a like it or not, because it's genetic material that we are analyzing, that there is no GDPR in place, but to our knowledge that is need to be done for the location, and then for the person who has the authorize on using the data, and then how the data are used. So that's how we work now. But then maybe this is coming from the private sector point of view, but I believe maybe public sector has a different point of view on how the data use. But on the other hand, I believe that open data should be done, because we are talking about this global awareness, and then SARS-CoV-2, COVID, and any other pathogens. I believe it won't be any problem of one country, but it will be a global problem, right? Because it's microbiome or microbiology, disease there can spread. There's no border between all of these issues, let's say. So for me, like, I would like to focus on regarding this data use more to be open. However, indeed, there is the need on authorized person who can access the data and how can maintain the data. So maybe that's something that to be considered on talking about the use of this wastewater monitoring.
I think privacy is the key issue, and the size or contribution to the sample, size or proportion of the population that are contributing to the sample, so that the data cannot be attributed to an individual. unless they authorize that. We've done some work where the entire city and part of the suburbs were tested, and the other point about that is that you get greater variability even with 24-hour composite samples. So we have to be careful what are the limitations of that sampling when you sample smaller populations. Issue that needs to be linked to that. And how is data then used? There was a question about tracking legal or illegal vaccine sewers, and that becomes, or pinpointing to the sources of those dumps or whatever happens with say chemicals. Lots of legal issues there, security issues. You can imagine that various government agencies could be interested in this. And I think for each and every study that we do, we also do an ethical kind of analysis or what are the boundaries. And I think that has to be part of any of the WBE studies.
And I would second about the illicit drug comment. Earlier in the year, I had the opportunity to speak with the Oklahoma legislature about what we're doing and the different possibilities. And right after the talk, I had several people come up to me, and they were concerned that we were looking for illicit drugs in individual dormitories, where it would give the opportunity for law enforcement to target specific areas. So how it's applied is definitely really important. Also the scale. If we're looking at a facility that has 30 people, you're getting down to a level that individual cases could make a really big difference. And that to me gets to be a little bit of a fuzzy area. And then finally, cultural beliefs are also really important. And an example I would give is I have some colleagues out in Arizona that are doing a lot of work with Native American tribes. And some of the tribes don't want their wastewater to be sequenced. They want to use different types of methods, but they don't want to sequence. They don't want their genetic material out there in worldwide databases. And so that is one other thing that wherever you're at, you really need to be cognizant of what the cultural considerations are that you have at that particular area.
It's a very good point. And a lot of projects fail because we don't take into consideration the cultural aspect, and the beliefs in a specific community or specific region. So in closing, I would like to thank you all for being here. Apologies, we couldn't take all the questions because of time. I would like to thank you all for joining us, and also our esteemed panelists. I know for some of you, even it was very early in the morning. Professor Savic, Professor Vogel, Kaushal, Dr. Windi, I really appreciate all your time and your commitment. Thank you.